I'd like to tell you a story today about a friend of mine named Chad. This talk is going to focus on steroid abuse and some of the little stuff that they do and some of the evidence. So there's Chad. He's 16 years old, normal-looking kid. He was told, "You're too skinny to play football at a varsity level." His older brother was a good athlete. His father was a professional baseball player. Football coach said, "You need to gain 25 pounds, son, otherwise you can't play." And Chad was interesting in that he really didn't focus on academics when he was in school, but he had like bodybuilding magazines in his book bag and in his locker, pictures of Arnold Schwarzenegger. So in response to his coach, from April to August of that year, he gained 32 pounds, primarily through eating a lot and lifting 1 to 2 hours a day, 6 days a week. He wasn't eating bacon cheeseburgers. He was eating very clean food, protein, bananas, peanut butter, eggs, 5,000 plus calories a day. And so to those of you that are trying to gain muscle, working out in the gym, Chad says that the main reason why people don't get gains in the gym is because they don't eat enough. You have to have enough fuel to rebuild muscle. So he gained all that weight, and then he did play football, but then he got hit, and his knee exploded, and so then he couldn't play anymore. So when you ask the average steroid user why do they start using steroids or what's the rationale, there's several reasons given. Probably the most prevalent is for athletic performance, right? The paradox of having to take steroids to become a good athlete, though, is that if you need steroids to be a good athlete, you're not a good athlete. So yes, you could cheat in high school and take steroids and then become the star of the football team in high school, but then when you go to the next level, you're simply not good enough naturally to compete. Same thing with college. If you're not a good enough player without steroids in college, once you get to the NFL, you're not good enough. And then obviously, even if you do make it into the NFL with the steroid boost, if you get caught, your career's over, right? You're never going to be good enough to make it. So that's the problem with the mindset of trying to improve athletic ability is you're not good enough in the first place. You have to be an elite athlete first, and then probably be super responsive to steroids if you want to be an elite athlete. The other reason why people start steroids is to look good holding a beer bottle, right? So they're in the corner with the very short-cut T-shirt flexing while holding their beer bottle. And of course, the irony here is that you can accomplish goals to look good here holding a beer bottle without having to take steroids through good nutrition and training. Instant gratification is something that's rampant, obviously, in the world and in the U.S. for sure. And so, the problem with instant gratification with steroids is the minute you stop, you keep eating like you were on steroids, you're going to get extremely fat. The extreme minority pursue a career in bodybuilding because it's a very, very hard life. Bigorexia is a condition in which it's akin to bulimia or anorexia, where guys look in the mirror and they see themselves as small, even though they have 42-inch guns like me. So, and then the other reason is sustained performance when older and rehab from injury. Right, so when you think about the modern day press, who gets caught using steroids? It's the old dudes, right? They're trying to keep up with the young guys because they're playing a game in which, the body's faster and stronger when you're younger. So here's the epidemiology of steroids. In the 70s, 15% of college athletes were using, in 84, 20%. There's many, many adolescents, greater than 1 million steroid abusers. If you go to the local gym and you see somebody that looks like a cartoon person, they're on steroids. It's like essentially impossible to look like that without anabolic enhancement. 80% for body enhancement by non-athletes. So a lot of these guys are in the gyms just to look good. And the people that I see most with this are firefighters, police officers, prison guards, military, the guys that want to have an edge on the street, etc., so they don't get beat to a pulp in the next prison riot. Abuse obviously trickles down into high school. Estimates are 4 to 6%, and we don't have really good numbers, but these are maybe ballparks. So back to Chad. He's now 17. His knee got exploded, but he has this interest in lifting, and he becomes apprenticed to a personal trainer at a gym, and he basically is left in charge because he's a responsible guy. He loves to do this. And so basically the owners of the gym give him the keys and say, take care of it. We're going for the weekend. So anyway, his trainer says, "Hey, I've got these pills. Do you want to try them?" So this is D-ball, Dianabol. It's a pill that you take. It's the most commonly abused oral testosterone that bodybuilders use. And so, he took the bag of pills and he brought them home, and he basically describes leaving them on his bed and kind of looking at them, and then like looking at the Arnold Schwarzenegger poster, And so he was really conflicted of whether or not I should take it, but I took them. And then he went back the next day to the gym, and the guy who gave him the pills said, "Did you take them?" I said, "Yeah, but I really struggled." And the guy who gave him the pills said, "Yeah, me too." He'd never tried them either. The guy who gave him the pills, right? But they both took it. Anyway, he gained somewhere between 10 to 15 pounds of primarily muscle on top of the muscle that he'd gained previously from natural training in about 6 weeks. So just insane gains in a very short amount of time. Let's talk a little bit about steroid side effects. So Chad experienced this. He actually really got scared because he got horrible back spasms. You have such a high metabolic turnover, you need all this water to build muscle. And so whenever you see these guys carrying around the gallon milk carton with like the strange colored liquid in it, that's because if they don't drink that, they'll get horrible cramps, right? That's why they're always constantly drinking, right? You can get something called test flu from high-dose injections. So if you start giving high-dose injections, you can get like a flu-like syndrome for several hours because of the injection itself. I had no idea that was a thing, but it clearly is a thing. Roid rage. So Chad, my friend, he actually doesn't believe in roid rage. He thinks it's more of a observation bias, that you remember somebody throwing a 100-pound barbell across the gym when they're in a rage, as opposed to some business executive getting mad at his employee, right? But then again, he does describe a time where he ripped a fence out of his ground and threw it across the yard, so maybe there is something to the roid rage. Testicular atrophy. Chad never worried about this. He said there's always post-cycle therapy, and indeed he had kids in the midst of taking a bunch of steroids, and his fertility was never a concern for him. More on that later. Gynecomastia he dealt with Arimidex. ED, there are certain steroids that do cause ED, but then you just take supplemental medications to fix that. Balding and acne is common. And then the thing about steroids that, the reason why people use it is because essentially it speeds up muscle gain and strength gain by about tenfold. So if you train perfectly for a guy that's not going through puberty and his testosterone is surging like Chad's was in my story, it's 5 to 10 pounds of muscle per year if you're lucky. That's with perfect training and nutrition. You can do that in a very short amount of time with steroids. So what about fertility concerns about the literature? If you ask guys who've abused steroids, very few have regret. But the 15% of the patients who use steroids who do have regret, it's all related to fertility and not knowing what problems it causes. Notice it's only 15%. And then there's a recent AUA survey that says that 25% of urologists would actually give testosterone to guys for seeking fertility purposes, right? Which is, makes them infertile. So it's actually the abusers know more about fertility than the urologists do, according to the stats. If of the guys taking steroids, according to a Trost questionnaire, my partner, most of them had fine pregnancy because they're smart. They take HCG while taking steroids, or they do post-cycle therapy. And the guys that did need help, 2/3 of them were able to got help and got pregnant. And then we know that guys who quit steroids, even if they're dumb about how they take them, most of them we can bring back to life and get them pregnant. So how do you get steroids these days? Well, it used to be you'd go to the gym and you'd go to the shady-looking huge dude in the corner, and then he'd get the stuff for you, right? And so then, but there's two ways to get it. You either go to it from a stranger in the gym, or you'd have this private group of friends where you'd lie to everybody else, and nope, we're not taking steroids. But then amongst you, you procure the drugs and share them. Things have really changed from this dealer model now. It's all internet-based. I mean, you can go on your computer right now, you can order tons of steroids right now. And then, basically Chad used a credit card to a Rejuve clinic in Florida, and they sent him the stuff in the mail. I said, well, God, don't people get arrested for this? I mean, this has got to get shut down. I was like, no. Remember that a lot of the police officers, a lot of the firefighters and stuff, these are the guys that want these steroids too. So what Chad did is he stopped eventually. I'll get to that point. But what he still does for a career now, he tells people how to take steroids safely and says, that's crazy what you're doing, do it this way. And he focuses on exercise, nutrition, and training. And people pay a lot of money for those services. And indeed, there's very few people as skilled as he is in the world to make these recommendations. So he has a huge clientele list, and believe me, they cover a large proportion of health service workers, but firemen, EMS, firemen, police officers, that type of thing. So the real deal. So he stopped 4 years of steroids because he had these horrible back spasms. But then, and then he won a competition for being clean. So then he's like, oh man, I like to win. He moved to Europe and he made contacts with Mr. Holland, Mr. Belgium, the third strongest man in the world, Mr. Universe competitor. So he made a decision to get hardcore. And he describes the time where he said, yeah, I really want to do this. And he was brought to a back room and the guy opens a secret closet and he pulls out this giant briefcase, click, click, opens it up. And it's just massive amounts of steroids like in a movie, right? And so that's when he really started to learn the nuances of this. Again, he was eating 5,000 calories a day, a pound of chicken, a pound of beef, rice, protein shakes, eggs. And he got big and strong, and he won some body competitions. So whenever I had Chad in my office, it was more him talking to me and me asking him questions than me helping him, right? So I said, hey, listen, I know I'm huge right now, but let's just theoretically say I wanted to gain 10 pounds or so. What would I have to do, and how much would it cost, and how long would it take me? He's like, he kind of sized me up. He's like, you're really small right now. I'm like, awesome. While you're trying to flex while he's, looking you over. And he's like, well, you're going to take this oral pill, D-ball. You're going to take 400 milligrams of nandrolone, 400 milligrams testosterone. You can take some Arimidex if you have some side effects. It's going to cost you about $200 a month because you know me, and I can get it to you for the real price. If you had to pay for it on the street, probably cost you $500. I was like, well, how much do I have to train? Hour a day maybe for 5 days a week. I'm like, really? He's like, yeah. I was expecting 8 hours a day, no. So he said, yeah, you'll gain 10 pounds of muscle in a month, no question. I'm like, wow, that's impressive, So Chad and I wrote a paper together on the secrets of anabolic steroid abuse, and we actually presented at the AUA. We basically asked him questions that I'm describing his answers to today. And this paper basically describes the real deal anabolic steroid regimen that people take. And it involves crazy stuff so it's got, T3 to speed up, metabolism. You get clenbuterol, inhaled medication, again, to lose weight. They take all this kind of crazy stuff. Just huge combinations of all these different drugs. And you can see, how much they cost and what they're for. They've done there's a lot of essentially underground work done. There's big books that people pass back and forth and try to add to, et cetera, to try to add to the knowledge. The problem is that, a lot of people who are dealing, it's in their best interest to give you stuff that isn't that effective, just to kind of keep you strung along, right? Anyway, so there's Chad back in the U.S. just prior to a competition. It's not me, don't get confused. So how and what steroid testing do people get? Well, there's a ton of variation. Most gym rat types don't get anything checked, right? People that are willing to take risks with kind of unknown bottles, from Mexico, they're not gonna care about stuff. But they're also, they're also gonna take risks with other type of stuff, which I'll talk about in a little bit. Misinformation is rampant. Like I said, the easy prey for the dealers. They'll say, hey, this works great. You just need to take this, blah, 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 give me $500. And then some know, or most know, to get chemistry, LFTs, thyroid level, CBC, especially if they're on thyroid meds, right? And they'll basically go to a primary care doctor, or they'll, he got his testing from, the script for the testing from Florida. Like you say, I need to test this, and then he gets it and he brings it to a local physician. They don't check PSAs, don't worry about sleep apnea, and surprisingly, he doesn't worry about myocardial infarction from T. Time to go pro. So he comes in second in an open contest. There he is with a giant trophy next to him. I would have, dressed like this for the talk this morning, but I ran out of baby oil, so I just wore this instead. Stopping steroids. So boom, his dad dies. His whole life, his dad knew that he took steroids. He knew that his dad knew that he took steroids, but he never told him. It was never brought up. It was always denied. I'm not doing that, right? So his dad died suddenly. Like I said, he was a professional baseball player, and he's like, what am I doing? This is just insane. And so he stopped everything, just cold turkey. And he came to me, and he's depressed, suicidal, no energy. He's like, Doc, you got to help me. And the first day wasn't he wasn't honest with me. He's totally honest. Listen, I've been abusing steroids for several years. I will tell you anything you need to know. Ask me what you need to know and just help me. So I tried to give him, max HCG, Clomid, everything I knew how to give him. But, the analogy is I took the little paddles and I put them on his testicles and yelled clear. and like nothing happened. Like they were completely unresponsive to everything I did. So he's now on lifelong maintenance T. The main problem was that I couldn't get his natural testosterone level high enough for him to feel okay. And the problem is that these guys who use these insane levels of T, I think they reestablished their receptor sensitivity and their T set point, right? So they need to have a T of 1200 to feel good. And when they're taking steroids, their erections are 12 out of 10. And then when they take non-steroids and they have normal erections that are 10 out of 10, they're like, this is horrible, right? So they have this different mindset. Their energy level is different. And there's an addictive property to it too. They want to feel like they felt when they were on it. So here's a headline: over a quarter of the field from WrestleMania 7 is dead, right? And so then, like 4 years later, 2014, somebody writes an article: the very high premature mortality rate among active professional wrestlers is due to cardiovascular disease. So they looked at a kind of a case control study, and the relative risk of dying if you were a professional wrestler from an MI at a young age was 15-fold, and the relative risk of dying from an overdose death was 122-fold, okay? So herein comes the blending of like observation and science, and we really don't have a clue. Clearly, a life of testosterone abuse leads to it. It's very easy to take Percocet, it's very easy to take cocaine, all these other drugs, and so you get into this rock and roll lifestyle, which ultimately is very bad for you, it can kill you. Is it the steroids that caused it? I don't know. We don't know. There's a lot of literature, a lot of work yet to be done. So I was on the internet yesterday, okay, and I found this article: Big Dead Bodybuilders, the ultimate price of pro bodybuilding. And it's hard to read here, but this is a column of down to here is all the bodybuilders who are dead with a mean age of 42. The predominant cause of death is cardiac. Here are guys that survived but all got renal transplants in their 30s, okay? So we don't know what the deal is, but it's awfully suspicious, right? There are a lot of men who die in their 40s of MI, bad genetics or whatever. But when you look at the literature, there seems to be something to it. So there's inconsistent findings if you abuse steroids, whether or not you change your blood pressure, whether or not your lipids are changed. But there are reports of like healthy 22-year-old kids who take steroids and they come in with an LDL of 600 and have a stroke or something like that, right? Then they stop the steroids and their cholesterol goes down to normal, back to normal. And so there's these anecdotal case reports of clear, correlation and time coincidence with resolution of these things. Same thing with left ventricular hypertrophy. This seems to be a very common theme among people who die. But the problem is, if you exercise and you get huge and muscular, your heart gets bigger too. So you don't know if it's actually causing the problem. There's actually one well-done study in Turkey, and there's a lot of steroid studies in Turkey for whatever reason. They basically randomized exercise regimens, same, and then steroids versus non-steroids. And the guys who were taking steroids had a diagnosable cardiac conductivity abnormality in the atria, okay? So a lot of these guys just drop dead. And so this may be the thing, that they have the propensity to get AFib and VFib, die. Chad didn't worry about this. I don't know how. There's all his buddies who drop dead. So what is Chad's opinion of what the real risks are? Well, chronic pain. You just beat the crap out of your body's joints and tendons by throwing around 150-pound barbells, right? Pathway to hard drugs from lifestyle, so now you're going to take other drugs of abuse. Kidney problems, that's where this insulin and Nubane are particularly bad, and that's why you get kidney transplant. Liver problems, extreme weight swings, new set point of normal. We talked about this, how you feel depressed when you're not on T. Cost and unemployment. You got to pay for this stuff, right? It gets expensive. So how do you pay for it? Well, you start dealing yourself. 2, you become a prostitute. You sell your competitive clothing, i.e. your bikini brief, to people who are interested in buying it from you. You go to hotel rooms that let people touch you. These are real things. Prostitution is rampant with both men and male and female bodybuilders. Sponsorship, rare. Secondary jobs. This guy with the, standing in front, he's getting paid. So what's Chad's opinion of T abuse now? Kids, don't do it. First of all, when you're a kid, your T level is high enough, you should be a natural athlete for at least 5 years before you even start thinking about doing steroids. And the only reason you do it is if you want to become a pro bodybuilder. Gym rats, don't do it because you're just going to get fat. While you take steroids, you're going to eat like crazy, and then you're going to stop the steroids for whatever reason, and then you're going to get fat. And professional athletes, he thinks it's probably reasonable, especially for the older guys trying to do rehab and heal. So what does that mean? I'm going to take 30 seconds longer. So here's a rabbit. If you give this rabbit testosterone, his joints heal faster after surgery. Bodybuilders have been using HCG to prevent infertility for years, And we just published, not we, a paper was published on this a few years ago, like it was a novel thing. No, bodybuilders have been doing this for 40 years, and we're just publishing about it now. Testosterone and weight loss. Testosterone is the only drug that causes true weight loss without recidivism. And there's a lion, and I'll take my last 30 seconds here. I'll go over a little bit. Does anybody know what's special about the lion? So the lion's mane is directly proportional to its T level. So the good lions will have a healthy mane, and the old lions will get ostracized because their T levels go down, and they have to leave the pride. All right, thanks for your time today.